Pain management in pediatric patients includes wide variety of techniques to minimize the pain and to provide a positive dental experience for those young patients. General anesthesia or deep sedation are often required to complete necessary dental radiographs or treatments in young uncooperative children. Dental treatment under general anesthesia has several advantages. It does not require the patient cooperation, and the patient is unconscious and non-responsive to pain. In addition, all the necessary procedures can be completed. Treating pulpal infection in young permanent teeth in children and adolescents present a unique challenge to dental clinicians. And also dental clinicians has reported success rate for conventional endodontic therapy in adults ranging between 40 to 97%, and this variation is due to the lack of clear definition of the success and failure of endodontic treatment under full sedation. This retrospective observational cohort study was designed to compare the outcome of root canal treatment under general anesthesia or local anesthesia in permanent teeth of children with mature and immature sample. In their methodology, all the patient data was taken from the database which holds electronic medical records. Patient age were between 8 to 15 years old, admitted for non-surgical root canal treatment in permanent dentition between 2015 and 2020, with a minimum of 1 year follow-up. Following their inclusion and exclusion criteria, they did use Frankel classification to determine if the patient would receive the treatment under general anesthesia, and all the treatment were done following the standardized endodontic treatment protocol. For the outcome assessment, all the follow-up appointment used radiograph using paralleling technique, and the clinical examination collected radiograph were independently examined under magnification twice by two examiners at an interval of almost 20 days. And all of these examiners are endodontists, and they use the scoring system of preapical index. The outcome was either favorable or unfavorable, and favorable outcome is decided whenever there is no signs and symptoms of the patient and the preapical score was less than 3. And also they did add the as an outcome variable, which is the corona restoration, whether favorable or unfavorable, based on the radiographic interpretation of the 2D images. Their findings revealed that from the sample, which is 326 teeth from 269 patients, with a recall rates of 81%, 124 teeth were treated under general anesthesia, and 142 teeth were treated under local anesthesia, and it is showed on table number 1. A total favorable outcome from the local anesthesia and the general anesthesia was 90%, and the unfavorable was 10%. The favorable outcome from the general anesthesia group was 97%, significantly higher than the non-general anesthesia group, representing 87%. The total outcome was significantly affected by the type of the restoration and the quality of the restoration. So stainless steel crowns showed 94.3% favorable outcome compared with composite restoration, which showed 90.1%. There was a significantly higher favorable outcome for fully formed teeth than immature ones, 93.9% to 83.9% respectively. And also we can see on table number 1 that the lesion size also has significantly affected the outcome. So lesion size that has larger lesion that more than 5 millimeter had a lower success than teeth without any lesion on the radiograph. In conclusion, from this retrospective study, more favorable outcome of root canal treatment can be obtained under general anesthesia than local anesthesia if the procedure is carried out with immediate restoration. Let's keep in mind that this study is retrospective. It is subjected to bias. Also, all the treatment has been done by a single operator. And when it comes to the calibrated examiners for the radiograph, they did not check statistically if their calibration was efficient using kappa coefficient, for example. Thank you.